Thank you, Mr. Speaker. Thank you to the members. Thank you to the members that are here. Thank you to the members that are in their offices and those who are voting remotely by proxy. Certainly appreciate the debate and would like to try to wrap it up as best as I can. I too want to thank our frontline workers, the individuals taking care of the patients on a daily basis, whether it be at hospitals, in homes, or at the nursing homes, one of which who happens to be my wife, who works at a hospital. I shared earlier that I'd spent 13 years behind a mask, most of the time in an operating room, sometime inside an angiography room, doing invasive procedures. So it is important that we all lean on our own experiences to understand what we are dealing with here today. Mr. Speaker, like many Pennsylvanians last evening, we listened to the governor, and he said to the people of our Commonwealth, we share your fears and frustrations, fears for your health and the health of your loved ones, fears your job may not be there when this is over, fears what the impact will be to your children's education, and your fears for what your future in this Commonwealth will look like. Mr. Speaker, I agree. That's a lot of what I've heard in my own district office for the last half dozen weeks. In fact, that's exactly why we are here today. That's why we are working every day to find a path forward, to work together, and to find the best path forward for all of Pennsylvania. I know we've quoted scripture, and I'll throw out my own. When there is no vision, the people will perish. This is really about planning for the future, having a vision of where we can go, and not just the immediate moment or the crisis. And I think this is important, Mr. Speaker, because the timing of this bill, as I will get to later, will be built on. This is about understanding what this disease has done. The statistics are terrifying, and I understand that. And they will continue to get worse in the coming months. But we need clearly defined goals of what is success. At what point does the data turn? And at what point are we able to move forward? It is also recognizing that another surge or possible seasonality of this disease, that we could be living with COVID-19 for months or even years to come. My friend, the minority whip, pointed out, and he's correct, we're potentially months or years away from a vaccine. So it's important that we have a vision. It's important that we have a plan in order to get back to work. I think if you listen to the debate here today, we're not disagreeing on the end goal. We might disagree some of how we get there, and that's okay. And that's not, to borrow my friend, the Appropriations Chairman, a political process. That is the legislative process, and that is why we are all here. It's the legislative process so that we can talk about different ideas. Some amendments get accepted, some get voted down. Some of the bills that we put on the calendar don't pass. Some never come to be. That is all part of the legislative process because we are the people assembled, and that is our job. I truly believe we must hope for the best, but we have to prepare for the worst. That's part of having the plan. It's recognizing that the citizens of the Commonwealth have great resilience and strength, that we will go to great lengths to do what is necessary to fight against this invisible virus while responding and being empathetic to the very real human suffering, fears, and illness that we've all fielded in our district offices over the past few weeks. However, it's also about recognizing that the quarantine is a limited tool, and when it is lifted, we must discuss the fact that there will be additional cases. It's also recognizing that the first peak could be days or even weeks away, but we will only have the advantage of retrospective review to know when that moment has already passed. So now is the time to plan for the future, and we should do so today. We've seen the results, as was pointed out by prior speakers, and I agree. This is a novel virus. It's new. There is no playbook for this as we're working through it. But what has happened, as other speakers have pointed out, is that you've got a wide swath, 1.4 million individuals on unemployment, relying on a system because of, quite frankly, the volume that has been dumped so suddenly and abruptly into it, simply cannot handle. So yes, that's stressing the system, but that's also not having a plan. Managing the moment is important, but that cannot be our only focus. In deploying the quarantines and closing business, I understood the urgency and why it needed to be done. I personally conveyed that to the governor. It bought us time for hospitals, PPE supplies, and ventilators to be made available and sought after. It opened up hospital beds as they deferred non-emergency surgeries. Many hospitals are operating at roughly a 50% vacancy rate, which in regular times would be good, but it's because they're waiting for what will come. And unfortunately, because of the current way that our health system is constructed, that means significant cash flow problems and access to services that our constituents and our residents are suffering through. In that regard, the quarantine was successful, and I'm grateful for the governor's swift actions, even though we may have disagreed on some of the process. We've spoken about those, and I appreciate the changes that were made in response to our input. But I also know that we both, in fact, all of us here today, have the best interests of the Commonwealth and its citizens at the center of our decision-making process. However, we have to plan for the future. If we are to face another surge, whether it be in a couple months or it turns into a seasonal event, as some have predicted it could, the people need to know that we have a plan where we've considered all the options, a plan that will unfortunately return us to what someone called this morning the new normal. I think that's important, Mr. Speaker. The reason is very simple, and it's centered on my biggest fear. My biggest fear, and the one I am most worried about, is this. If we do not start talking about the future, specifically what the effects of the quarantine have done and what their limited purpose was supposed to be, and this is very important, the quarantine worked, but it can only work in the short term. And if we were successful, that means there's more individuals who have not been exposed than those who were. So whenever the quarantine is lifted, that means we'll have more cases. So my good friend, the Democrat leader, is correct. I do think that we can do this in stages. I do think that we can approach this in a slightly different way. My fear is this, that when the cases increase, people will mistakenly believe that the quarantine somehow failed. They need to understand its original purpose. They need to understand that it was meant to buy time. And we need to understand, and most importantly, have people believe that if there is another increase in cases, there's another surge, or there's another need for a quarantine, what the value in the quarantine is. What we cannot risk is have people simply saying, the quarantine didn't work last time, so why should we listen this time? Part of that plan, quite honestly, is recognizing the difference between the short-term and the long-term goals that have been set out, which I think we could all articulate better. The quarantine was an immediate short-term and successful goal, but it severely impacted everyone's daily lives. But it's not a long-term solution. If we, like the experts, believe that this could go on into the summer or resurface in the fall, then the answer cannot simply be, we will wait until it's over. Our people cannot survive that length of uncertainty or lack of long-term plans. That is why we need a long-term plan and process by which to operate as a society again, and to do so safely. This reserves a complete quarantine option again for the future, because we've had time to prepare and have people understand what is actually happening. The complete quarantine option, while effective in the immediate short term, is not sustainable over the long term. For me, I think the distinctions for businesses, and we use the terms today during the debate of essential, non-essential. I believe that's incomplete. We also need to discuss about safe and unsafe. Grocery stores and hospitals are very essential, and I thank the employees for their efforts who work in both of them. But they're also not the safest places to be. That's why we've seen the measures taken. My own grocery store has went and made certain aisles one way. They stagger the registers. They determine what the spacing will be. It's clearly marked on the floor. The hospitals obviously have PPE, and we need to get more. We know that this is a reality of these places, and we should also enter those two terms into the discussion. We've passed legislation, as was mentioned earlier, securing PPE supplies for hospital and frontline workers weeks ago. Businesses like grocery stores and hospitals have made changes in how they operate to lessen the risk, just like we've made changes here as a chamber to allow for proxy voting and social distancing. We do so because as a society, we recognize the needs that each of these places addresses, and we take the steps necessary to continue accessing them and their services. If we know we may have a second surge or additional seasons of this, we need to have a plan. We need to have that vision and be ready to act when the data says it's time to act. The jobs portion of this bill, which was spent really the lion's share of the debate today, for me is quite simple. It's about transparency and consistency. We recognize these choices will be made when the data says the time is right. The timing of this proposal is very important, and we actually opened up with some questions regarding the technical amendment on this. And I'd like to lay it out before you. Assuming it passes today, assuming it goes to the Senate, you are still potentially 18 days away from this actually being implemented. If the current downward trend continues, we will have the act in place that we can operate from. Because here's the timing. While it becomes effective immediately, the governor has 7 days from signature to post the proposal that's consistent with CISA and the CDC. He has 10 days to decide if he wants to act on it or not, constitutionally. And I think that's important because this is about positioning the plan so we can have the discussions. And that means that the immediate decision will not be made today, but rather it could be slowly reopened over time. It's laying out a plan by which it can be done in the coming weeks. This will ensure that similarly situated businesses will be in a position to continue operating with the CDC recommendations that its competitors are also following. We've heard stories about inconsistencies. This would address that, Mr. Speaker. And there was questions about which medical professionals should we trust. Mr. Speaker, I would argue that the CDC is really the highest experts in the land. That's how they got there. 42 other states currently follow these guidelines that we're looking to implement. Some of the same states that the governor is currently working on a reopening plan with. I think that's important, Mr. Speaker. And this has been said from the beginning, but I believe it's worth saying again. This involves people who want to and can safely do so. They can return to work. This enables us to save both lives and livelihoods. We have all spoken with constituents, friends, neighbors who are in situations that quite frankly look like they are no-win. I mentioned the surveyor who lives in my district last week that I'm privileged to represent. But today I'll share a story about a friend. It's a friend who's a stonemason who works with his son and his father. The three of them are a multi-generational business. My friend is the fourth-generation owner of the business, and he's the sixth member of the generations in terms of being in the trade. He's faced with an impossible predicament, Mr. Speaker. As we see the federal money, and I heard some say, well, we just need to wait for the federal government. The federal government is busy arguing over whether or not they wish to release additional funds to the program that's already been tapped out. Mr. Speaker, he was politely told that there were no additional funds available, and he's now left with this impossible choice. He can try to work in a limited fashion, or he could go bankrupt. He texted that to me just this week. The irony here, Mr. Speaker, is these three individuals, my friend, his son, his father, they're quarantining together. They eat dinner together every night. But the nature of some of their work they do is non-essential, and the waiver they received said you can do essential work as defined by the government, but not non-essential work at this time. That's why I believe that the current essential and non-essential designations are incomplete. And we should look beyond that and ask, can it safely be done? In their case, they are oftentimes the only workers on the job site by the very nature of what they do. We as a society accept risk as a portion of our lives all the time. In fact, the governor's own waiver process itself does a cost-benefit analysis of what safeguards should be put in place and what businesses can continue to operate. We've all highlighted where things could have been better, and I understand that. But in the case of the individuals that I'm talking about today, they work local and with the very same people they live with. We have to have a purposeful plan to survive the current situation, but most importantly, simultaneously be looking to the future in the event that this happens again. We need to look at work that can be safely done if they so choose. Those individuals should be included. I understand that not everyone wants to do so. That's okay. Remember, that was the opening point. Those who want to do so and can safely do so. That is what we should be focusing on. The governor's own waiver process, as I mentioned before, proves that some jobs with certain restrictions can continue. We should allow businesses to adapt to the current environment just like we have. Find ways to limit interactions and promote safe transactions, just like 42 other states, Mr. Speaker. Some people I'd offer, in fact, probably many people, could modify their work environment to safely work alone or with limited contact. These should be the very first people we try to get back to work, and this bill does that. We need a long-term plan. We need to communicate it and understand what is coming in terms of additional patients. The task force we passed last week provides the forum that this employment bill envisions. The citizens also need to know that this fight against COVID-19 could be a very long fight, one that will require interbranch cooperation and coordination. We understand, I think, as legislators, because we've both spoken about it, the enormous weight that comes with the power of the executive and the emergency powers that are being exercised. We stand here today as willing partners looking for solutions with other branches of government so we can solve this crisis and the short and the long-term challenges together. This is about planning for the future and not just the immediate moment. This is about understanding what this disease has and can do in the coming months. It's recognizing that another surge or seasonal swing, we could be living with COVID-19 for months to come. But that future must have the structure and consideration it deserves, and this bill takes one of the many needed steps. Our process should be dictated by data, it should be coordinated between all branches of government, and it should return those who can safely do so and want to do so to work. Return them to their jobs so that they can keep their health insurance, the ability to earn a living and pay their bills. Mr. Speaker, that's what this bill is about. I would urge a yes vote.